And thank you for joining our Thinking Differently series. We are going to pause for just a moment while we let individuals get into the webinar, and we'll kick off in just about 1 minute. Thank you for being here. All right, we'll go ahead and kick off our presentation this morning. Again, thank you to all of our attendees for joining. My name is Dr. Cheryl Richards, and I have the privilege of serving as the president and CEO of Catapult, which is your employers association across the Carolinas. Our mission at Catapult is to provide employers with the confidence to navigate everyday operational challenges, to make your workplaces more effective and your employees more successful. We do that through a variety of resources for our members. We also do it through our Thinking Differently series, where we bring timely topics to members and non-members so that we can help you navigate through the challenges that you may be facing in the workplace. May is Mental Health Awareness Month, and we know that the pandemic has put an extremely strong burden on all of us over the past 2 years. We've had to think differently about how we approach work and everyday habits. And we're pleased today to be joined by Ward Blanchard, who is the founder and CEO at the Blanchard Institute. He's going to lead our session today addressing mental health in the workplace. Let me tell you a little bit about Ward's background. Ward's behavioral health career was cultivated through working in all facets of the behavioral health treatment industry. Since moving to Charlotte, North Carolina, he has become one of the most prominent health and substance abuse disorder professionals in the country because of his innovative work with clients and their family systems. Ward founded Blanchard and Associates over 10 years ago as a private practice focusing on family restructuring, family case management, and family consulting. In 2017, he established the Blanchard Institute, which was a dual diagnosis outpatient treatment center that incorporates comprehensive family-focused care. He and his team approach treatment for behavioral health conditions through a unique family systems model that utilizes multiple evidence-based modalities in their innovative Blanchard family process. Ward has a master's degree in psychology, marriage and family therapy, and an MBA in healthcare administration. He specializes in dual diagnosis treatments and obtained his advanced addiction counseling education credential through the California Association of Alcohol and Drug Counselors. He is also a licensed clinical addiction specialist and a credentialed clinical supervisor. Ward, we're so excited to have you join us today. And before we jump into the bulk of your content, I thought we would start by asking our attendees to participate in one of two poll questions that we have. So if I can ask our events team to please go ahead and list our first poll question. For you, those of you that are listening in, please let us know, during the past 2 weeks, how often has your mental health interfered with your ability to get work done or accomplish tasks? We'll take just a moment to collect our responses. All right, and here are the results of the current poll. So somewhat often and not often, coming in leading with about a third of our attendees, with another portion, kind of a traditional bell curve here, Ward, on whether or not mental health has interfered in accomplishing our work. Let's do a second poll question now, and that is answering the question, do you feel like your company's leadership prioritizes mental health at work? We'll take just a moment to collect those responses. All right, and here are the results of this poll. Nice to see that at least 44% of you feel like your company is prioritizing mental health. Great fertile grounds for you, Ward, to talk about the resources perhaps for those that fall into the no and unsure category. So with this said, thank you, Ward. I'll let you take control of the screen and begin your presentation.
Yes, ma'am. Thank you very much, Dr. Richards and Catapult, for having me have this conversation today with you guys. And I really would like this to be a conversation and a dialogue as much as possible as we go through this material. And you have any questions, I really want to encourage and empower anybody and everybody to ask a question in the chat. And because now is the time to do it, as you guys just discovered through the polls there, that mental health and substance abuse issues are, some of the most hot topics of the conversation, not only in day-to-day life, but in our businesses, in our social circles. The stress of the pandemic and the toll that it's taken on us as a society is, without question, the number one conversation phone call I get, not only from individuals and families that are struggling with this personally, but most of the time my phone's ringing, and it's businesses and organizations and chambers around the state that are noticing and gaining awareness on the impact of substance use disorders and mental health on their workforce, on their employees, on their bottom line. And, whereas in 2019, we thought we may have had some sufficient mental health support and EAP support and workplace support, as this pandemic sort of entered our lives and interceded, we learned some significant lessons, about ourselves and the way we exist and the way we function and the way we operate, not only as just human beings, but the way we operate our organizations. We've learned a lot over the past 2 years, and the stress and trials and tribulations that we've all endured over the past 2 years. We can look back and we can complain, or we can use these as opportunities to learn how can we better operate in our stream of life, not only personally, but professionally. Because I can tell you, we're going to talk about some of the lessons that we've learned over the past 2 years and how they intersect with what we know about mental health and substance use disorders. Because the one thing we can say, even before the pandemic, is the conversation about the opioid epidemic was brought out into the light and brought out into the conversation. There wasn't a newspaper you could open or a news station you could turn on and not hear about the opioid epidemic. And so that conversation started in the early 2000 teens. But since the pandemic, we have noticed something significant. Whereas mental health and substance use disorders are diseases of isolation, words like quarantine and social distancing and isolation and virtual connection do not sit well with human beings who need to be safe, secure, and connected from our biological needs. When you start talking about isolation and quarantine and social distancing, that goes against our very biological, natural DNA and genetics. And so we have been living in an environment, the globe has existed in an environment over the past 2 years that goes against every fiber of how we are created. And so human beings, without question, have been impacted by this pandemic. The question is gaining awareness of how that impact has affected us, not only personally in our own lives, in our families, but in our organizations. Because we know that this chronic stress that has compounded our lives in 2020 and 2021 has created a situation where the average human being condition, the average human being response to the pandemic has been stress, has been anxiety, has been increase in mental health symptoms. That stress that has been ongoing for 2 years has really taken its toll on us as a country. We have noticed that things and statistics that strike home even here in Charlotte-Mecklenburg area, we know that since February of 2020 until August and September 2020, the first 6 months of the pandemic, the 5150 involuntary psych hold at the hospitals increased 250% in the first 6 months of the pandemic. We also know that even here locally, although the psychiatric holds skyrocketed, we know that alcohol consumption skyrocketed by over 800%. And so what we have seen is this chronic stress that sort of has hit our lives in this existence that's very inhumane according to how we are built and how our genetics are structured, where we need this safe, secure connection. We need to live and work in community. The past 2 years of the isolation, the distancing, and the chronic stress has really taken its toll, and we see that in our mental health lives every day. For instance, we even know that even as a microcosm of the impact is even the substances that are being consumed now reflect the anxiety and chronic stress, because what you see here are the chemicals that are considered downers, the chemicals that are considered those that treat stress and anxiety, your alcohol, your Xanax, your what we consider downers. They have skyrocketed in their use over the past 2 years. And so we can see statistics all over when it comes to the increase in impact in mental health and substance abuse. The CDC just recently came out with the horrid statistic that in the past 12 months, the opioid overdose have cost us 100,000 American lives. We also know that that was opiates. We also know that alcohol-related deaths have been 105,000 related alcohol deaths. These numbers are staggering. And there was a conversation that happened even a decade ago or even 2 decades ago that workplace in your professional life doesn't have any influence in somebody's mental health outside the workplace. And although that was a very unfortunate and stereotypical stance 10, 20 years ago, we know that is not the case now. The conversation about mental health, mental wellness, substance abuse in the workplace, we absolutely know and understand that that needs to be a top priority in conversation, in our workplace, because it's a basic understanding of not only the humanistic approach toward our staff, toward our professional family, but also the bottom line approach. Treating this disease and learning and gaining awareness about the impact of mental health and substance abuse in our companies is by far the best thing to do from a humanistic standpoint and bottom culture, because we know that the chronic stress and of this pandemic and what that does to the human body. We know that chronic stress and chronic anxiety, what that does to just the human condition is it doesn't make us function very well. It doesn't make us operate very well. Chronic stress and the stress and anxiety that is supposed to be in our lives is supposed to be short-lived. It's supposed to be in our system and out, in our system and out. But the problem with this pandemic and the problem with really American society, even before the pandemic, is we lived in a world where exhaustion was a status symbol. That whether it was the constant technology or the constant work, we lived where, like we say, and I say we, myself included, we lived in a world where even I wanted to drive down my neighborhood, pull in my garage, shut the door behind me, because hell, if I wanted to say hey to the neighbor walking their dog down the street, because I'm too tired from work. And so we lived in this world where exhaustion was a status symbol, where technology was prevalent, where we were the most disconnected society ever. And here in 2019 and 2020, we had a pandemic come on top of that and really throw people's mental health and stress and anxiety into overdrive. And the problem with that is how that impacts our functioning as just human beings. We know that in order to have healthy brain functioning and healthy operating, that we've got to manage chronic stress better. Because if you're talking about your employees and the impact of having untreated mental health issues and untreated substance use disorders and that stress and that anxiety, we know that it shuts off their frontal cortex and hyperactivates their fight or flight symptoms. And you don't have to be a licensed professional, you don't have to be a doctor, you don't have to be a neuroscientist to understand that employees do not function very well. Your company does not function very well if you've got a bunch of employees that are operating your company without a frontal cortex. Probably not the best scenario for your company and for your overall organizational culture. And there is this unfortunate stigma that we can't have that conversation in or outside our offices. Despite this being the most prevalent condition across the globe that we experience, what you see here is a heat signature map that shows what we were just talking about, that this is the overdose deaths that have impacted our country going back to 1999 to 2014. And if you'd see a heat signature map that showed it currently, which we don't have at our disposal yet, I guarantee you that whole country would be red. And so despite the fact that so many of us have been impacted, there's not one person walking the planet right now that hasn't been impacted directly or indirectly by substance use disorders. Despite that overwhelming prevalence, we still have this barrier of having those conversations, of understanding and gaining awareness of how to support one another, and more importantly, access to treatment. And what we know and what we've understand is we can appreciate and have learned how to use all the different stakeholders in an individual's life when treating this disease. Work and people's employment lives and their EAP and access to resources that they can get through their professional stream is monumental in the effort to help somebody. And when we begin to have these conversations, because mental health is such a taboo topic, most companies feel that if they have the token, drug force or workplace initiative, if they have an EAP, that they've got that covered. And what we know is that's just not true. That despite having EAPs and despite having token workplace initiatives, we know that there's still a struggle to actually create true change in the organizations and inside of our employees. And in order to find this solution and our way out of this mental health mess, we need to really act and apply what we know and what we've learned, which is evidence-based solutions. Because those individuals and staff that work in organizations with EAPs, only 3% actually access what they need, with 46% that need help, that are afraid or either don't know how or either struggle with that conversation. 46% that need our EAP resources or our organizational support don't access it. And so if 3% access it and 46% need it but don't access it, then we need to look at our part as the workplace of what we can do to provide this space safer and easier for our professional family members to access. Because like we said, across all lines of demographics, across all socioeconomics, across all companies, mental health and substance abuse has no prejudice and no boundaries. This is one thing that does not discriminate. I call it the equal opportunity destroyer. And despite that reality that so many of us struggle or know the struggle firsthand, there's so many misconceptions and misinformation out there about this disease that are key to understanding the problem and the solution that employers can play in it. Because most of us don't realize that 76% of people who struggle with any form of substance use disorder have a fully functioning job. This idea or stigma that it's the junkie under the bridge or the drunk in the alley or the individual that can't properly function, this idea that is addiction is grossly inaccurate and misinformed. It's quite the opposite, that the majority of individuals who struggle with any form of substance use disorder have a fully functioning job. Those individuals who are more severe in their mental health conditions and their substance use disorders where they cannot function is actually a very, very small percentage. when in fact, most of the people who we treat and we know who struggle with disease, who go untreated and suffer in silence, have a fully functioning job or are possibly doing well in school. And so it's really important to understand the misconceptions out there, because there's so many of us. 1 in 5 of your employees goes home to a family member that's struggling with this condition, and how that impacts them at work. We also know that 49% of U.S. workers currently, struggle with some form of substance abuse. One of the most common calls I told you I get is from chambers of commerce, and it's from individuals who have never experienced or had a history with mental health problems, never had a history with substance misuse or even substance abuse, now starting to present and have significant issues show up as the depression and anxiety, the levels over the past year to 2 years have added up, or the substance consumption through no fault of their own, whether they went to the doctor and said they're not sleeping or they're stressed and were prescribed medicine, or if one of those glasses of wine at a happy hour turned to 2 or turned to 3, substance consumption dynamically increased over the past 2 years. And so when we talk about understanding, it's putting measurables to understand the impact and cost is a huge part of this too. We know that the annual cost of mental health across the globe is over $1 trillion. And that was a number that the World Health Organization just came out with. And even they themselves say that number is not possible to be calculated accurately, the damage and the ripple effect that mental health and substance abuse has. Most people don't realize that depression, clinical depression, is the leading cause of medical disability worldwide. And so whether it's pure mental health, whether it's substance use disorders, whether it's the combination of both and dual diagnosis, there is no question that it is showing up every day in your organizations to more people than you know. And despite having put initiatives into place, or putting additional resources and additional finances into place to support your workforce and their mental health, we know that even though that's increased over the past couple of years, that we still have a long way to go as far as the solution in learning how to provide true effective support to our loved ones, because it is unequivocal that the value of putting money and putting investment into mental health awareness and mental health support. We know that for every $1 you spend on mental health support, you get a $4 return on your investment, where you have absenteeism increase, problems with supervisors start to go away, risk mitigation. There's just so many reasons to do that, not only from a bottom line standpoint, but more importantly from an employee-centered organizational standpoint. As whether it's personally or professionally, we have these biological needs to be safe, secure, and connected in our jobs. We need connection, we need community. And when we have mental health issues and we have substance use disorders, we're going to learn what a disruption that costs and that causes, in our companies and in our systems, and how and what can a workplace do to help solve this problem. Because there's that misconception that it's the drunk under the bridge or the junkie in the alley, and the people that are functioning at work couldn't possibly have that big of a problem. And that's that misconception of addiction that people don't truly understand. It's that scarlet letter A that we're afraid to stamp on people, when the true epidemiology and the few patterns of this disease, we know that it happens on a spectrum, that that the actual people that struggle that severely, that can barely function, is actually less than 8 or 9%, when in fact overwhelmingly the majority of those people that struggle with either pure mental health and substance use disorders are functioning and interacting in daily lives. We know that this has the same epidemiology and patterns that diseases, heart disease, that asthma, that diabetes has. When we talk about relapse of this disease, it carries such a stigma of failure and such a consequence. And yet we don't understand that this falls in line, this disease that falls in line with ups and downs of relapses, instability, relapses, instability, and stability, that spectrum and that roller coaster, that the patterns of that roller coaster are just like every other disease that we know, every other progressive disease, hypertension, asthma, diabetes, have the same reoccurrence and relapse rate as substance use disorders. And so understanding that this disease, its patterns, its impact on the individual that's suffering is very medical and is very disease oriented, is not choice related. And the most important part of this entire presentation, and if there's not anything else anybody takes from this lecture, it's the next 5 minutes. I spend the rest of my career shooting down two statements when it comes to mental health that the professional community and even the self-help community often tell individuals and families that are struggling with disease that they really have to want it to get better, and they have to hit rock bottom to get better, and how categorically false that is from all the medical evidence that we have. And I clarify that with companies and families and say, if your loved one and your staff member is going to live a long-term life of mental stability, of sobriety, of recovery, they're going to have to want it. They're going to have to engage. They're going to have that internal motive change, but not in the beginning, not when they're in our office, not when untreated disease is showing up in our day-to-day office spaces, because what we know is substances of abuse affect the body differently initially. We have uppers and we have downers. Some people like to go fast, like cocaine, speed, methamphetamine. Some people like to go slow with alcohol, benzodiazepines, opiates. Uppers and downers affect the body differently initially. But in the end and in the long run, all of those chemicals and substances of abuse affect the body and the brain the same way. And they shut off or severely diminish the activity in the frontal cortex. And why is that important to this conversation? Why is that important to you guys and what we do in our companies? Is because the frontal cortex controls ethics, morals, executive functioning, common sense, rational decision-making, emotional regulation, personality, empathy, ability to organize linear thoughts, spirituality. Everything that makes somebody unique and individual and human is in that frontal cortex. It's not working properly. That's why one of the first comments I hear families say is, I just want my child back. I just want my spouse back. It's like Invasion of the Body Snatchers, Dr. Jekyll and Mr. Hyde. It's like, this isn't the person I married. This isn't the child I raised. This isn't the employee I hired. It's like, that's exactly right, because the part that makes them individual, the parts that makes them unique, the parts that separates us from reptiles, it's not working properly. That's why humans, that's why we don't eat our young and reptiles do. It's because we have a frontal cortex. That limbic system is that reptile part of the brain. That frontal cortex is what makes us human. It's what makes us unique. It's not working properly. That executive functioning part of our brain, the motivation part of our brain, is not working properly. So why would I ever tell an individual or a family that without a working brain, that they need to understand, gain the awareness that they need it, and have motivation to get better? This is a disease. This is a medical disease. Somebody's not going to get better because they want to get better. They're going to get better because they comply with their medications and take their insulin every day and take their medications every day. When you're looking at the impact of this disease, whether it's substance use disorders or whether it's pure mental health, because we know overwhelmingly the majority of every mental health disorder that we see, even standalone, is a dysregulation in the frontal cortex, regardless if that's bipolar or ADHD or what have you. That's that cognitive dissonance, that impact on the frontal cortex that really, really shows up in our lives, that shows up in our companies. And that is why it is so important to understand this disease and its true impact and how it presents. Because people without a frontal cortex, they can't gain that awareness by themselves. They can't, they don't have the cognitive ability to do that. That impact on the brain, your brain does come back, the healing does happen It just takes time. It's called neuroplasticity, the retraining of the brain's pathways. It takes about a year or two to stabilize untreated acuity, untreated diseases and substance use disorders or mental health. It takes about a year and a half. And I tell families as a whole that it takes 2 years to stabilize this disease. There was never anybody in our professional community that communicated 30, 60, 90 days is the way that your brain heals or way to treat this disease. No, that's not at all. We actually know quite the opposite, that the healing of the brain, the retraining of the brain's pathways, the neuroplasticity actually takes a long time. It heals with consistency, not intensity. It's like going to the gym. We don't get in shape because we go to the gym 48 hours in a row the first weekend in January. That's not how we get in shape. We get in shape 1 hour every day, very routine, very consistent, very boring. It's the same thing over and over again. And that's exactly how the brain heals, with consistency, not intensity. And it takes a while for that brain to heal. What you see here is the brain impact of, somebody, the top line, the horizontal line. All you need to pay attention to is that's the functioning of a healthy, normal brain. That middle line is the functioning of somebody 10 days abstinence from substances. And that bottom line is somebody 100 days abstinent from substances. And just think about the impact of that would have on an individual's life, an individual's family life, and a company's life. If you've got employees that are functioning with that level of cognitive impact, making key decisions, you have a visual, glaring representation of the toll that it can take on somebody's ability to make healthy decisions. And the hope is that we know how to treat this disease. We know that recovery and mental health stability and mental health wellness is absolutely possible. This is an image that shows you that brain coming back after 14, 15 months, just beginning to stabilize. And because that's how long it takes. That's how long it takes for just neuroplasticity to happen and to occur. And there's only but so much people can do when it comes to understanding how to help with that disease process and how long that takes. And the involvement of workplaces and employers is enormous in the ability to support and have outside support to help individuals and help their families recover. Because as we said, mental health issues and substance use disorders, it takes away somebody's, ability, what I call their self-awareness. That frontal cortex is not working properly. And so they often can't see the damage they're creating. It's not their fault that disease developed in their system. And it still is their responsibility to get treated and do what we have to do to recover. And when it comes to the workplace and the ability for companies to work with their employees, the understanding of how much of a role and healthy influence a company can have in not only supporting that conversation, creating a space to have that conversation, but also support that in working in line with the treatment center. Because that's what one thing that we try to do at TBI as the Blanchard Institute is here in Charlotte as an outpatient resource. We are a community-based resource where we have people that enter our care for a spectrum that can last as long as a year. And it is key in our approach that we work with outside key stakeholders inside the treatment center, whether it's their work or whether it's their family or whether it's their school. We really try to work with other key stakeholders in an individual's life, because you have to think that you have that identified patient who is operating in the stream of life without a frontal cortex. And so their family, how they live, their jobs are huge parts of their day-to-day stream of life. and can be integral components of their entire recovery and recovery care team, is what I call it. And some of us may say, well, that's not an employer's role, or we shouldn't have to do that. Well, there is a reality here that we should go ahead and accept, that whether we should or whether it's fair or unfair is a different discussion. The reality is, these are the people that are showing up in our organizations. This is the impact that stress and anxiety and substance use disorders has had on them, and this is the reality that we have to choose to navigate through. And so, how are we going to deal with the current reality, and what can we do to be a part of that solution? Is an understanding that when somebody has these mental health issues, when somebody has these substance use disorders, that number one, they don't have to want it to get better. That is categorically false. That, getting them into treatment with the help of family making the initiative, with the help of employers making the initiative, with the help of legal issue making the initiative. These are all 3 points, whether there's legal reasons, whether there's a family intervention, or whether there's an employer intervention. We actually know that individuals and clients that come under those circumstances have an overwhelmingly higher prognosis, because that leverage, that support in the beginning helps the treatment center get the patient's compliance. Because as we just saw a few minutes ago, that when you have a client struggling with that sort of lack of brain health, nobody in this virtual room would ever trust somebody with that level of brain functioning to have any influence over somebody's life or death treatment plan. So why would we let somebody without a functioning brain have a significant influence over dictating what they want and what they need? Because this is just like any other disease, that if you follow the professional's direction, if you follow the professional's guidance, prognosis is good. And if you don't, prognosis is not so good. This is just like any disease. At 18 years old, I was diagnosed with an illness out of the blue, just a day before I was supposed to report to Chapel Hill. Never drank, never smoked. I was Athlete of the Year in North Carolina in 1999. And then in August, I was given 2 years to live. I was diagnosed in August, Friday the 13th, 1999, given 2 years to live at the Mayo Clinic, and had 87 surgeries, a trach and an oxygen tank. 6 months later, I didn't want one of them. It was unfair. It was painful. Every one of those surgeries was uncomfortable. I was angry. It was costly. We had to take off from work. I had to take off from school. I didn't want chemotherapy. I didn't want radiation. There's nothing about a healthcare crisis that people want or are motivated for. But I complied with what they need, and it was still the appropriate path to save my life. And I needed a whole lot of support, just like any progressive disease. You need a very different level of professionals to treat all the different aspects that any progressive disease has an impact on somebody's overall health. You have all different professionals treating different components of somebody's overall body and overall health. It is no different with this disease. We believe that every identified patient needs a recovery care team that includes the professionals internally working with the key stakeholders externally, because the goal is to get them functioning and autonomous and healthy and more connected in their community and in the stream of life. That's the ultimate goal. And you can see that step down treatment, that spectrum of treatment that's outside, that is, people don't get sober and stable in an inpatient alone, where inpatient is very helpful. People learn to get sober and learn to get stable in the stream of life as they're functioning in work, as they're navigating, their family dynamics, as they're navigating just the basic trials and tribulations. That's where people learn to apply the healthy mental health techniques, the healthy recovery techniques, with the appropriate titrated support that understands the expectation of the disease, of how their brain functioning is coming back, and correlating professional services as such. You can see, this image is just a mirror image of, that's why outpatients and the most successful treatment we know matches the treatment with the evidence-based of their brain functioning, where people can be in an outpatient from 5 days a week to 4 days a week to 3 days a week to 2 days a week to half days a week, finally to 1 day a week. And as it titrates down in corresponding to how their brain is healing, that is dictated and delivered by professionals, not by family members or identified patients Googling WebMD, because that's not how we treat this disease. We treat this disease with evidence-based methods that understand that compliance in getting patients into the support, complying with the treatment, has everything to do with their long-term prognosis rather than want. The National Institute of Drug Abuse, all these national organizations have so much research that says motivation and want has zero bearing on overall outcome. What we need is compliance. What we need is that's where we work with EAPs and companies, whether the company is supporting them through appropriate accountability, or if a company is supporting them because the individual reached out for help. The understanding is that evidence-based treatment and the role that the workplace can play in it focuses on the help that they need, which is an understanding of the brain, our human needs, like we need to be safe, secure, and connected, and how that impacts that. Your workforce is the conversation that everybody has either heard or been privy to lately when it comes to organizational culture and staving off burnout, that all this has played into this terrible climax of the Great Resignation and the burnout ratios and the increase in mental health and increase in substance use. That we know that right now our workforce needs measurable vulnerability, compassion, an established workplace community. That's how we create sustainable ways of working and sustainable ways of a healthy mental health environment. And these are just not soft words to put on a boardroom wall that you hear come out of John Maxwell or Gary Vaynerchuk or Brene Brown or Simon Sinek, all these individuals that have wonderful leadership messages. It's because the reason why they connect is because we have biological needs of belonging, of community, everything that they talk about in their leadership aspects, that with that sense of belonging, even in our workplace, even in our organizational family, that the importance of having a safe, comfortable workforce that people can talk to and feel, like I said, safe and comfortable in the middle of this time, that they've got the impact of chronic stress, chronic anxiety that's been going on in their lives since pre-pandemic, but certainly has been heightened for 2 years. We know that when people feel isolated, when they feel not socially connected, that their just human response is increased anxiety, increased stress, and the compulsion to instantly gratify that, whether it's substances or mental health medication. That's just the wrong medication, that our natural desire is to instantly gratify that. And so the solutions that the workplaces are involved with is really creating that culture change to enhance that belonging, enhance that connection, because that is essential to our overall functioning. In workplaces, not only with their work key stakeholders, but involving the family is equally important. Not only for what you saw, that every one of our employees, 1 out of 5 of them are going home to somebody else in their home struggling with substance use disorders. Not only that component, but the component that we talked about, that people need outside influential people to play a role in their recovery. Because if you left everything up to the patient, somebody without a functioning brain, which is sort of how we've done it the past 30 years, healthcare, this system has thrown it at their feet and said, you Google WebMD, you figure out what to do. That's why in 30 years of this industry, our medical prognosis, and our outcomes have not improved. We had the same effectiveness of treating this disease 30 years ago as we do now. There's no other part of the healthcare system that has not improved in 30 years. So we have got to re-examine how we treat this disease and what it takes, because the identified patient in the beginning without a properly functioning frontal cortex doesn't have the ability to want it or need to be motivated to get better. Like I said, these chemicals affect the dopamine, the motivation part of your brain. And so if that's not working, why would I tell them they have to be motivated to get better? They don't. It really takes family intervention, a supportive and compassionate, accountable workplace initiative to help force them into compliance, because then their brain heals and then they get better. And that education to the family, that education to the workplace, that education to the members that are around individual who's struggling. It's what I call the sphere of influence, whether it's the family, whether it's the work, whether it's the school, and whether it's their medical and other healthcare. All of us have to work together as a community if we're going to beat this disease, this epidemic that was here long ago. Let me remind you, it was 7 years ago now that at the time Surgeon General said we were in the worst public health care crisis our country had ever seen, and that was 2015. And so it has just skyrocketed, and we are still just not treating it properly. And so we have to understand and have to get comfortable in having these conversations and gaining the awareness that this is showing up. And knowledge is power, but more importantly, accurate knowledge is power. There's so much misinformation that it comes to the stigma around this disease, how to treat it, how to have conversations with people, that arming yourself with accurate information about how somebody actually gets healthier and what resources are available and how that should be done is a huge part of the solution, is understanding how that works. Because like I said, it's accurate knowledge that is powerful. And you guys who are here showing up as invested key stakeholders from employment, or maybe you have your own family member, let me tell you right now that the individual without a properly working frontal cortex shouldn't be expected to have the clarity, have the wherewithal, have the awareness to admit they need a problem and know where to go to get it. So we cannot rely on them. And so it is really up to us to have that intervention, to have that role. And yes, that is unfair, but that's a different discussion. This is the reality that we are functioning in. This is the reality that we're operating our businesses, and there's some acceptance there, which means we accept reality for what is and for what is, so we can learn how to navigate it and learn how to negotiate it. Because we've also learned that although we have poured money and poured investment into new initiatives the past 2 years, we know that although that has improved access and people have access telehealth, we've seen very little change when it comes to coworkers. There was actually a 5% decline in coworkers felt comfortable talking to other coworkers about it. Coworkers feeling comfortable in supporting another coworker. And so we can still see that when it comes to navigating the conversation in our workplace, despite it being everywhere, that we still struggle as human beings to have those crucial conversations from emotionally connected places. And how does a workplace like you guys work in an employee's life and begin to have those conversations, to open it up, to start, is the first part that is the essential foundation of the building block of you guys creating an overall workplace that's safe to talk about this. That conversation is key. Dr. Richards, I see you on the screen. Is there?
Yeah, thank you, Ward. Yeah, we're getting close to our time, and we have a couple questions in the chat. So maybe we'll go to Q&A, and if you want to turn the screen share over to our events team, they can take that off so that the folks can see you really quick. The question is, the first one that came up is somebody has completed the mental health first aid and would like to offer that for the staff. Do you know any providers that can present it in Spanish? And in particular, they happen to be in the Mooresville area.
So, well, thank you very much for even asking that question about training. We can get more specific referrals and resources I have, but I would like to comment on the general part of that question. I think it is, and I'm of the school of thought, it is essential for organizations to do all staff trainings about this disease. I mean, our companies, and I'm an entrepreneur myself, we do diversity training with all staff. We do sexual harassment with all staff. We do nonviolent with all staff. Substance use and mental health needs to be done with all staff. That way, it also is less alienating. It's more, inclusive. It takes the, whodunit out of it, but just making it mandatory. All staff is absolutely what needs to happen. And recognizing if you have a demographic that needs some special consideration with language and other cultural diversity barriers, to ask and find those resources. And so there are some resources that we can provide you, but also there's a reality. If you're in North Carolina, I was at the North Carolina Healthcare Summit right before the pandemic. North Carolina has the highest rate of mental health and substance use to the lowest rate of available resources of any state in the country. And so that is also a reality that we're navigating through.
Mm-hmm. Thank you. We will have some resources we'll put in the chat, and all of attendees will receive a follow-up email with the recording and some credit information for HRCI, SHRM, and CPE credit after the event. And so we'll make sure that we get some of these resources that Ward has shared, as well as other ones, out as part of that email. Let me ask you another two kind of related questions that came in here. One, the first part about it was, how do you identify when someone is struggling? And then the second part of that is, how do you encourage compliance once you've identified that there's a need?
This is great questions, because the number one question I get is, well, they're over 18, they're free, and it's like, absolutely. And for 15 years, I was a clinical interventionist around the country. That means putting people in treatment who didn't want to go. And so the understanding there is that this is just like any other disease when it comes to identifying. You just, we seem to accept that with this faction of the healthcare system, we allow the client and the family to sort of dictate what treatment they need. There's no other disease that somebody would just call me, never come in for an assessment, never come in for an evaluation, and say, this is what's going on, where do you recommend? And professionals will give recommendations out without ever seeing or assessing. And that's a huge problem, because most companies and family members don't know our industry, the behavioral health industry, is ungoverned and unlicensed. And so there's no mandatory protocols anybody has to go through. And so there's not a guarantee that people are using evidence-based methods. And so people get it in several treatment centers because they don't have the proper assessment tool. Because the first step that you ask about is they need to go through an assessment. Just like any other disease, if you called the medical provider and say, hey, this is what's going on, they would still come in for an assessment, which is a measurable tool. Most people also don't realize that that's a tool that we have that's not just psychobabble. It's just stick our thumb in the air. It's called a biosocial assessment. It's a series of questions and evidence-based tests that come out with results that are measured by what's called American Society Addiction Medicine 6 dimensions. And the 6 dimensions are, whether it's people's readiness to change, people's home environment, people's mental health, people's, comorbid medical. There's 6 dimensions that we evaluate with measurable tests that we go through this assessment, and it gives us a measurable recommendation about what level of care and what they need. And so when anybody, the first stage is referring them to an assessment that is done by a licensed and trained professional using ASAM to decide what levels of care. And I believe the other question is about compliance. Listen, like I said, I was an interventionist around the country for 15 years. I never had the power of the state to take somebody's civil rights away. And the understanding of somebody without a frontal cortex, whether it's untreated mental health or untreated substance use disorders, has to have help to exist. Somebody without a frontal cortex cannot exist in the stream of life without other key stakeholders staving off the consequences, whether it's calling the boss or paying the rent or making the excuses or what have you. And so how do you force compliance? It's not punishment. It's not taking their civil rights away. And it is about setting boundaries that influence compliance as best as possible. And I'll leave you with this because it comes to the success of this. I get asked all the time about success rates, and because this is a significant risk. We know what works in this disease. In fact, any treatment center that tells you a success rate to the treatment center is lying to you, because we haven't figured that out yet, how to measure what success is. If somebody goes through Blanchard and has a relapse immediately, but then stays sober the rest of their life, is that a success? We haven't figured that out, how to measure that. But we do know one demographic very well. Doctors, lawyers, pilots, nurses, those people struggling that have licensure, they have a 90% success rate because they enter diversion programs that have them monitored, drug tested. They force compliance, and then they're monitored rigorously for about 5 years. So we have 5 years of data that shows 90% success rate. The general population, if I'm honest, is more like 7 to 14%. And that shouldn't be, because I can create the same treatment plan for the licensure professional as I can the general public. The only controllable difference is working with somebody in their employment. For instance, so people will say, well, that's because they're a doctor or a lawyer, they have a high-priced degree over their head. And I said, I know that sounds like it may be true, but the same success rate is true for the stewardess or for the dental hygienist. The only controllable difference is that diversion program, their employment says, if you want to keep your license, if you want to keep working it, you have to go into treatment, and they force compliance. If they want to keep certain positions, if they want to keep, you have to comply and do what, I don't care if you think you have a problem, I don't care if your family thinks you have a problem, you have to comply. And then you've got a 90% success rate. Over here, the same treatment plan, I'm entirely dependent on educating the person without a frontal cortex and their family member who's in the middle of a trauma cycle themselves. I'm entirely dependent on educating them to hold boundaries, to force compliance. And that's why getting EAP and companies' involvement as healthy and appropriate leverage and accountability is overwhelmingly a significant factor in improving success.
Well, and I think with that, you've just proven the value of all of the attendees that are on the call today, who were here listening into the workshop. We all play a role in helping our colleagues and our friends and our family face the chronic stress, anxiety, and the workplace of exhaustion that you described. I know our team has some resources they'll put up here on the screen. The other resource that I'd like to mention is Mental Health America of the Central Carolinas. Amazing organization, works closely with the Blanchard Institute, has a number of free mental health education and support programs for adults, for youth, for families and businesses. It takes a village, and we want you to have all of these resources for you and your employees. You can continue the conversation, check in and ask questions in our member community. Our events team will put a chat in a link to that in the chat. And then we invite you to join us again for upcoming events. Later this month, we have our Employment and Labor Law Conference presented by expert attorneys from Ogletree Deacons, and that will be in the Raleigh area. The in-person registration is now closed, but virtual registration remains open. We have a number of events coming up in June, including Disrupting Local Healthcare on Tuesday, June 7th. This is where we'll explore health benefit options for employers who are looking for improved plans and lower costs. And then our next edition of Thinking Differently will be held on Tuesday, June 4th, where I will be joined with Deborah Punke, who is the Chief HR Officer at Concord Hospitality, and our own Kirsten Laura, Vice President of Learning at Catapult, who will discuss building your culture. Thank you, everyone, for joining us today. Thank you, Mr. Blanchard. It's been truly an honor to have you here with us today. Everyone, be well, and we'll see you next time.
Thank you. Bye, guys. Thank you.